Hi, this is Dr. Kenneth Beer in West Palm Beach, Florida. Hope you guys are all riding out the quarantine safely and enjoying the time with your friends and family. We're going to talk today about some injectable fillers and things that we can do when the quarantine lifts. As part of this, we're going to have questions and answers, and if we don't get to your question up front, please don't worry. We'll get to it this afternoon and make sure that we answer it. In addition to that, we are having a virtual week of beauty. So it's an opportunity for you guys to call the office. You can purchase fillers and injectables and lasers and a variety of other things so that when the quarantine is lifted, we can get you in here and start making sure that everybody looks as good as they feel once everything is back to normal. So that's at 561-655-9055. So let's just jump right in. Today we're going to talk about the fillers and things like Kybella and all kinds of products that we use in the skin to make you look and feel better. And the nice part is there are so many opportunities and so many products now that are available. Whereas 10 or 15 years ago, we only had a few things. Today, we have probably about 20 some odd products available that are approved in the United States. And there are a lot more approved outside. So Canada and Europe have probably 40 or 50. And there's going to be more in the US. So it's going to be an ever-changing landscape. It's going to be a lot of fun for those of us in the industry because, for instance, with this newer round of products, we were part of the clinical trial, so we've been using them for months and months and months, and we'll have the opportunity to train other physicians, which is always fun. So today we can start by answering some questions you guys have, and feel free to go ahead and ask them. So when we started with everything years ago, we used to inject collagen. And collagen was a product that was okay. It wasn't great. It really didn't last as long as it should have. And it was lumpy and bumpy. There were 2 or 3 different types. And this is probably 25 years ago. We were injecting that. And then along came Restylane, which was being used in Europe and Canada. And Restylane was a nice product because unlike collagen, it was clear and it was a gel. So it was smoother and it was more long lasting. In addition, it was made out of biocompatible hyaluronic acid. And hyaluronic acid is a sugar that's found in all of your joints, all of your skin. It's pretty much ubiquitous throughout nature. And it's one of the products that really has done well over time. So we have more than 20 years experience with that product. Restylane has been evolving over the years. So we started with just Restylane. Then it evolved into a thicker product called Perlane. Perlane then got rebranded as Restylane Lift, but it's the same as Perlane used to be. And those are products that are gels that get pushed through a screen. So instead of being a solid block like Jell-O would be, if you take a block of Jell-O and put it through a screen, you can get fine little particles. So if we have a big screen, you get Perlane or Restylane Lift. If you have a smaller screen, you get Restylane. And you can do just about anything with these products provided you know what they are and where to place them. They're really nice products. And those are from Galderma. There's a whole other family of Restylane products, including Refine and Define, that use a slightly different technology. And there the sugars are cross-linked and a little bit smoother. So they're better for areas like the nasolabial crease that is subject to a lot of motion. So we use those all the time in areas that are moving a lot. There's also some newer products called Restylane Kiss, which, as the name suggests, is designed for the lips. And those products are all highly biocompatible. Patients do really well with them. As with any product, you can get some lumps or bumps, but typically these are minor. In addition, as with any injection, you can get a little bit of bruising. Then there's a whole other family of products called Juvederm. It started with Juvederm Ultra and Ultra Plus, and these products are all from Allergan. So there's a whole range of them. We now have Juvederm Volbella, which is a really nice product for the lips. We have Juvederm Velour, which is an intermediate product that we like a lot. We use this a lot in the nasolabial crease. We use it in the marionette lines. And then something that's become very, very popular is Juvederm Voluma, which is designed for cheeks. We also use it in other parts of the body, such as the temples and a variety of other places. And it's just done remarkably well. So jumping back, what we use a lot of in the office, in addition, are things like Restylane Lift that I mentioned before. And there you can see the product has lidocaine in it. And what the lidocaine does, it makes for a much more comfortable injection. This being Restylane Lift, it's a little bit thicker, and we use it a lot for sculpting the face. So the cheekbones, the temples, the marionette, the jaw, sometimes we place them deep to build. And again, as we mentioned before, this is regular Restylane, which is still pretty very popular all throughout the world. It's a really nice product. We use it for a variety of things. It's just the workhorse of a lot of practices. All right, so next we have some other products that are a little bit different. So from the MERS family, we have something called Bellatero, which is a really, really nice product. It's soft, and we use it a lot in the area around the eyes. We use it in the lips. There's also something called Radius, and Radius is really nice. There we go. Radius is a calcium-based product, so it's a little bit white. It's a little bit more durable, but at the same time, it's very thick. So it's great for structure. We dilute it out or reconstitute it and inject it in the back of the hands, and it does well. I like Radius for people with thick skin or men who have really, really deep folds. It's a wonderful product. We typically inject it with a cannula, and it does really, really well. So that's another option. Sometimes when people just lose volume, we like to use something called Sculptra. And Sculptra is a series of injections that we like. Usually we do them 4 to 8 weeks apart. And what this does is stimulate your skin to gradually make some collagen. Each time we inject either 1 or 2 bottles, depending on how much land we're covering. And it's sort of like planting grass. You just put it under the skin and watch it grow. So this is a really nice product. Sometimes we use it in the mid-face. Sometimes we use it in other parts. And the nice part is you can reconstitute it based on where you're going to put it. So you can make it more or less dilute. If you're using it on the legs, the butt, the face, you can blend it as you want. So this is a great product, but it is dependent on your body's ability to make collagen. So that varies in different people. So one other thing that we inject a lot of is Kybella. And sometimes we'll use this with our Cool Sculpt device or other machines. This is a great product for getting rid of some excess fat. We use it primarily in the area under the chin, but there's all kinds of other places we put it too. And it works really nicely. Like other injections, though, it's not one and done. We typically inject this 2 to 3 times, depending on the area and how many bottles we're injecting. So there's a whole range of products that we use. Let's take a look for some questions. So one of the questions is, which product would you use in different areas? And really it depends on the thickness of the person's skin. For thin-skinned patients that are looking for fine lines, sometimes we'll reconstitute or blend with some lidocaine to thin it out. And sometimes we'll use a very soft or smooth product. So the nice part about having all these products is that we can blend or customize, or we can just use different products based on what we're trying to accomplish. So it's a very different scenario now than it was even 5 years ago. We see Kristen. Hi, Kristen. Thanks for joining us. And Colleen, thanks for being on. And Carla. So really a nice group of people. And we're happy to answer any questions you guys have. So the other thing is which product lasts the longest. And it really varies. I think if you inject one product 2 or 3 times in the same region, you'll start to get duration. And that's always nice. If you do it once a year, you'll tend to get hills and valleys where your face looks really good and then the product dissolves and goes away. So we try and have people come in more consistently and try and develop a program that fits their goals and their budget and their risk tolerance, because sometimes you'll get some bruising from these injections. Doesn't really matter who does it or how it's done. Some people just tend to bruise. And I find that in my practice, if we have them on aspirin, they bruise more. I try and get people to stop taking aspirin a week before, but we have people on blood thinners that do perfectly well, and we have people that don't take anything that bruise. So there's a whole range of people. When we're filling the cheeks, we like to use a thicker product, so something like Radius or Voluma or Restylane Lift. And when we're doing fine lines around the mouth, we like to use something like Restylane Kiss when it's available, or Restylane Silk, which does really, really nicely. We also use a lot of Obella in that area, and sometimes we'll reconstitute some of the regular Juvederm or Juvederm Ultra Plus. And that works really nicely. We use very small microneedles for that, and we get a lot of very pretty results. So in terms of that, the durations are all different. Some of the newer products are more durable and will last longer. So there's a benefit to using them if you want to go long distance. A lot of people like to get injected twice a year, which is what we recommend, mostly because the body is always changing, so we can always keep up with it if we have more opportunity to inject and sort of customize your face. Sometimes people come in and they want to do every 8 to 12 months. And for those people, we have to end up using a lot more material to try and cover all the ground. So that's when we use different things. There's a question about Kybella. And what we see is Kybella has been very, very popular. We're seeing a lot of people using it off the face where it's approved for. So we see it used sometimes in different parts of the body. And it works pretty nicely. Again, it's just an experience type of thing. If you've used a lot of it, you'll be fine getting it done. So then there's a question about Radius. Radius tends to be good for very thick-skinned people with deep folds and wrinkles. I wouldn't use it around the mouth, and I wouldn't use it in the lips at all. So you just have to be careful about that. It's also white, so you want to be careful that you don't put it in places that you'll see white lumps or bumps. It's designed to be placed very deeply. Let's see, what else do we have? Sculptra. I like Sculptra a lot, particularly in patients that are over 60, because what it does is it restores collagen and elastic fibers, and that's really a nice way to help people. And it's a durable correction. That is, if you do enough of it in the beginning, what you can do is have the person come back every 8 months and do a bottle or two as a refresher, just because we can reverse the clock, but we can't stop it. So a lot of times it's really nice when we can see you a few times a year and sort of do maintenance on that. So that works out really, really nicely. Let's see, we have Gabrielle there. Nice to see you, Gabrielle. We know that you've always been a big fan, and we appreciate that. Any other questions or any other comments that I can mention? One question that we always see is, what's the difference between fillers and Botox, or fillers and Dysport, or fillers and Xeomin, or fillers and Jeuveau? And the difference is the botulinum toxins that we use tend to relax muscles, whereas the fillers and the other products tend to add volume or subtract volume, depending on where we're putting and which product we're using. So there's a big difference, and you want to make sure that you're being injected by somebody that knows the difference and somebody that does a lot of this. you wouldn't want somebody that doesn't know the difference or interchanges the two, because if you put them in the wrong places, you can have a really bad outcome. And we try and make people look like they're rested, but still they recognize themselves. We don't want dramatic transformations, just people that look like themselves 10 years younger. So we'd welcome you to attend our virtual Week of Beauty. We're having some promotional products and some interesting combinations of things for those of you that haven't been able to come in the past few weeks. We understand your frustration, and when things ease up, we're certainly going to try and get everybody in. So just be patient with us, and we'll be happy to work with you. Let's see, there's Lauren popping up. Hey, Lauren, how are you? Thanks for being here. If there are any other questions, we're happy to see you or chat. And again, if you have questions later, feel free to call us at the office at 561-655-9055, and we'll be happy to speak. Again, visit us online, take a look at what we have. The virtual Week of Beauty will be phenomenal, and we welcome you to attend it. Thanks again for your time. We'll do these every day and look forward to speaking to you. Thanks.